My name is Dr. Stanley Jacobs, and I'm a facial plastic surgeon, but years ago when I was a kid growing up, I really loved Egyptology, Egyptian things. I thought it was fascinating, the science, the pyramids, who isn't interested? But what happened to me was that I joined something ARCE, which is a group called American Research Center of Egypt. And what happened was I went to a meeting at Berkeley in the year 2000, and I was lucky enough to buy something called the Edwin-Smith Surgical Papyrus, which is what I have here today. Edwin Smith was an American who bought an actual papyrus in the late 1800s in Egypt. And he knew enough to know that something was special about this papyrus. There was about medicine and probably surgery, and he was right. It's the first documentation of really medical and surgical principles in the history of mankind. It's certainly the first that actually talks about you have a diagnosis, you make a diagnosis, then you get a treatment. It's not just hocus pocus. And I was told there's only about 200 copies of this in the world, of this book, the translation, and I was at this meeting at Berkeley in California in the year 2000 in April, and I happened to come across a book vendor that just happened to have his only copy here for sale at that time, which I bought. And it was translated by James Breasted. James Breasted at the time in 1930 when these books were written was a very famous Egyptologist at the Oriental Institute in Chicago. He was so famous that Howard Carter, when he found King Tut's tomb in 1922, asked James Breasted to come and to interpret the hieroglyphs there. So that's what these represent. So there's a 2-volume set. And this is Hieratic, which is how they wrote. It's actually black and red. And I've seen the actual papyrus. It is owned, these papyrus and the copyright for the books are owned by the New York Academy of Medicine. But they're actually now, right now, have been for a number of years in the Metropolitan Museum in New York. And as you can see, this is Hieratic, how they wrote. And by the way, I've seen it in real life. It's way darker and more black, and the red ink is as bright can be today, 3,600 years later, which is fascinating itself. And on this page, you can see it says recipe for complexion and for making skin more youthful. And that's something that we didn't expect the Egyptians were actually doing. And you can tell this is the typical hieroglyphs where you can see little squiggles of and drawings of owls and serpents and things. So that was photocopies of the book at that time, of the papyrus, I'm sorry. But the most interesting thing was the English textbook, which obviously, as you can see, is a very large book. It's over 500 pages, and it goes through brain surgery, trephination, subdural hematoma, meaning draining of the blood, penetrating into the spine, temporal bone injuries, nasal reconstruction that I do today is very similar to what they were doing packing the nose. So they were very smart at surgical medical principles. But what really captured my attention after reading this for a few months was on page 492, which says, recipe for transforming an old man into a youth. So of course that caught my attention. What the heck was that all about? So I started reading this in earnest because I thought, well, if they're that serious about medicine and surgery, they're going to be that serious about a recipe. But the problem was obvious, because as soon as they start describing the chemical process, which is quite elaborate, it's about 4 pages in chemistry, in their terms, it says the word hemayat, H-E-M-A-Y-E-T, fruit. Let there be brought a large quantity of hemayat fruit, about 2 kar, which is about 2 bushels. The problem is that I went to Egypt 3 times, and for 8 years I talked to people, Egyptologists all over the world. Nobody knew what hemayat was. They said, Stan, we've researched it, we just can't put it into the right context. There was another person, Lise Maniche, who's a very famous Egyptologist at the Louvre Museum in Paris, who thought it was fenugreek. Reading through this chemistry, to me, having a chemistry background in my undergraduate training, didn't make sense to me. That's too wispy, it didn't seem right. So I continued my search and talked to Zahi Hawass, who's the famous Egyptologist in Egypt and was the head of the Supreme Council of Antiquities, who was a very nice man and was generous enough to talk to me and many other people. Finally, after 8 years, I talked to Dr. Kent Weeks, who I think is also very famous, well, is a famous man, I think is a great guy. And I went on a tour with him and my family in one of our visits, and he's in charge of the Valley of the Kings. In fact, it's called the Theban Mapping Project. If you look that up, it's an amazing project. He's actually responsible, he's American, for the entire Valley of the Kings where all the pharaohs were buried, except, of course, some of them aren't there. They're in the Cairo Museum. But for instance, King Tut is there, of course. So he's a very famous man. In fact, he's so famous that he found the largest tomb in the Valley of the Kings, KV5 or Kings Valley 5, which houses the 52 sons of Ramses II. It's a 110 chamber room, and I went on, and a few other people, on a private tour of that chamber. I spoke to him as well. He didn't know either, by the way. He finally got me in touch with another Egyptologist, James P. Allen, who was the head of Egyptology at the Metropolitan Museum in New York for many years and did an actual special presentation at the Metropolitan Museum on the Edwin-Smith surgical papyrus. It just happened. Well, he got me in touch with him, and he told me in his writings and his description that it was bitter almonds. So here I am in California thinking, okay, bitter almonds. What's bitter almonds? They're not sweet almonds. I look them up. I don't know what they are. I go to Whole Foods. They thought I was crazy. And it turns out that they have a poison in them, cyanide. And when you read the chemistry in the text, when you process bitter almonds, according to what they do, when they say they taste the water of the Nile and the bitterness comes out, it's because the cyanide is being removed. And when I took chemical formulas, like, you write COH or whatever, and you do that chemistry with their description on the left, you can actually see in the chemical process that the cyanide is removed. And at the end, you have a molecule which we now know as mandelic acid, German for almond, or Italian, mandorle. So what this means is that the Egyptians were using an alpha hydroxy acid, mandelic acid, derived from bitter almonds, that made their skin better. Now, how do we know it was used for that? Because it says at the end of this wonderful text, I'll read it, anoint a man therewith. It is a remover of wrinkles from the head. When the flesh is smeared therewith, it becomes a beautifier of the skin, a remover of blemishes, of all disfigurements, of all signs of age, of all weaknesses which are in the flesh, proven effective millions of times. So there I thought, of course, that's about as good a clinical trial as anybody could have. They had to have obviously done this iteration of the process thousands of times. How would they know it was bitter almonds to use in the first place, and how would they know it would really be effective? I mean, you can imagine 3,600 years ago, this was going on. So that means that the pharaohs, the queens, Cleopatra, Nefertiti, King Tut, Seti I, Ramses the Great, all came after 3,600 years ago, probably would have used this product because that's how they worked. Pharaoh to pharaoh passed on information. That's how they were so brilliant, and fortunately they wrote many things down. You had 3,000 years of uninterrupted, almost uninterrupted civilization. People wonder why they were so smart. They didn't have to worry about attorneys. They didn't have to worry about patents. They just passed down information, and they felt if it was useful, they would pass it down. So it's quite possible that Cleopatra and people like that were famous, and when people said they had beautiful skin, they were so beautiful. We look at drawings and pictures of people that are depicted today in the tombs of Seti I and all these wonderful looking people. Well, maybe that wasn't so much far from the truth. Maybe really they had great skin because they were using mandelic acid, which it seems like they were, well, it's obvious they were using that. It's also very intriguing that in the tomb of King Tut is a beautiful faience, or a jar, I'm not sure if it's faience, but a very precious jar that has 30 almonds in it. Now, I have to ask Zahi Hawass's permission at some point. Hopefully I can get that to see if they're bitter almonds, because if they're bitter almonds, there's only one reason why they're in his tomb. So it's a fascinating story that we're happy to share with people. It's something quite unique, and that was wonderful. It even says in here how it must have been very important, because it says at the close of the second process, the resulting paste is ready for use and is therefore placed in a toilet vase of some costly stone like lapis lazuli, jasper, or possibly alabaster or aragonite. So, and if you've gone to any of the King Tut exhibits, you'll see that their unguents, which they call them, which are the wonderful things to put on their face to make them look younger and more beautiful, were put in beautifully carved alabaster jars. They weren't just put in something simple. So it obviously played a big role. We also know that Egyptologists know that when tombs were raided, the first things they took were the beautifying projects. It wasn't their gold and the jewels. That was after. The first things they took were the unguents from those jars. Before, in terms of the history of this magical molecule, which we call mandelic acid, which we knew came from the bitter almonds from the Egyptians 3,600 years ago, that the pharaohs and the queens would have used, is like, well, what does that mean today? How does that help us today with our skin and our skin care? Because that's what we all want to know about. And this new molecule called mandelic acid is relatively new. We know a little bit about it before, in that it killed bacteria, so it could help with acne, maybe even pigmentation reduction. But what really we wanted to know about was about elasticity, about making the fabric of skin change. How can we make skin more youthful? That's really what we wanted to know. Fortunately, at about the same time in early 2008, I was fortunate enough to meet with Jules Aquino, who is a very famous chemist, cosmetic chemist at Estee Lauder for many years, and Avon, and made amazing products for those large companies. He became independent. And Tom Rubeck, who works for Grant Industries in New Jersey. Jules is in New York. And they came to me in February of '08 and said, Stan, we should talk about making a skincare company. I said, that's great. I talked to them about the books and about the history, but of course at that time in February, I didn't know that it was bitter almonds and mandelic acid. So they of course thought that was pretty funny because they thought I'd never find out what it was. They said, how do you know you're going to find out 8 years later? I said, you don't know me, trust me, I'll figure it out. But a number of molecules and ingredients that Jules Aquino was wanting to use that he couldn't use or just wasn't using it in Estee Lauder, like resveratrol, glucosamine, boswellia, and multiple agents that he knew were great for skin. And 6 months later, I found out about bitter almonds and mandelic acid. He then took our what we call the hero molecule, which is mandelic acid, and put it into our skincare serum. And that's what we came up with our viscoelastic transforming serum. So what happened was that mandelic acid, when we researched it, is a larger alpha hydroxy molecule. It's bigger than its cousin glycolic acid. It causes less irritation. It's good for all skin types. It's a bigger molecule, and it's wonderful. People can use it of all skin types. So what he found is that how do we make it synergize with these other molecules? It's not a question of just adding more mandelic acid. People say, well, I can just buy mandelic acid on the internet. Go ahead. You won't be able to recreate this kind of efficacy and synergy without putting all these, there's actually 40 different ingredients into the serum. So he did that for about 1.5 years, almost 2 years, and about 15, 16 iterations of the product before we came up with a final product, which is what we have today. But then let me move you to the next chapter in the book. And by the way, I have written a book, and we can talk about that later. But the important thing is, I'm a plastic surgeon, been doing it for years. He's a well-known chemist. We didn't have time to make something that wasn't going to work. We had to make something work. But how do we prove that? We can take before and after pictures like everybody else doesn't, which is great, and we have those pictures we have on our website and to show people. But we wanted to measure skin, and when I started researching what actual machine or gizmo will measure skin elasticity, it's actually called a cutometer. And it's made in Germany, and this is one here. The company's called Courage Kazaka. They're wonderful people in Köln, Germany, and they make these very precise instruments that actually took them 4 to 5 months by hand to make me one of these machines. And what it does, it's a fairly simple principle though, and that is you have a little probe that has a tiny hole at the end of it, and it has a spring-loaded end, and it has a light diode in there, and when it's hooked to a computer, you touch it to the face, and it simply sucks the skin away slightly. It's calculated every time and calibrated, so we know it's the same all the time, every measurement. And we can measure anything. We elected to measure lower eyelid skin, which you knew was pretty wrinkled in some people, cheek, jowl, and neck. Now we can measure any part of the body. We can measure thighs, we can measure forehead or whatever, but not many people are using this. In fact, I talked to the owner of the company, who are wonderful people. They said, Stan, you're probably the only guy who's using this as a doctor, in a private setting, not in an institution, to measure skin elasticity. So we use this, and in 12 seconds, it can measure skin elasticity. It's very accurate. It's accurate to 1 micron, which is almost a millionth of an inch. And what we found was that if people used our serum and our product twice a day, so they would use it twice a day. We had 28 patients, 2 men and the rest women, ages from about 40 to 65. Even one was a smoker. We found, on average, the eyelid skin elasticity went up 26%, measured with the cutometer. To give you an idea, there have been a certain study that was done with a laser on the face, and what they found was that a 22% increase in elasticity after 6 months. So to give you a sense of what that means, it's a large increase. So we were very excited about that. And personally, in my case, my eyelid elasticity was 38%. I went on the serum. A month later, it was 88%. I went off the serum for a month, it went back down to 30, I went on it again for a month, it went back up to 80, 85. So we knew it wasn't just by accident, it wasn't a fluke. That's when I really started the study in earnest. And then after we did our study, we took photographs, which I think are very compelling. we did an independent study at Essex Labs, which is in New Jersey. We gave them the serum, we paid our money, expensive tests, and we said check for elasticity with a cutometer, which they have, check for hydration, which they call transepidermal water loss, check for pigmentation improvement, tone, clarity, all of those things. We checked off every box. They had 30 women, same age range. They found, again, with their cutometer, increase in elasticity that was comparable to what we had. They also found a significant improvement in pigmentation, or reduction in tightening and toning of the skin. So, and what they called reduction in global, meaning all around, fine lines and wrinkles. They actually have computer software that measures pigmentation and measures lines and wrinkles. It's not I just think they look better. So that really supported us in a very big way, and has allowed us to really tell people and patients, anyone, in an honest way that we really think this stuff works for you. So that's how we developed our product in terms of the serum. We then developed a second product, which is called the Stanley Jacobs Transforming Synergy Peel, and that is, there are peel pads in here, and there's 60 pads. They're soaked in a special solution that has mandelic acid in it, but it's based on something called a Jesner solution. So Jesner is a famous solution that we use in the office for chemical peels that doctors have been using for years, but to my knowledge, nobody has figured out how to use it at home. So I did what we call split face experiments for about 2 years on my patients, doing different dilutions of concentrations. And what we found is that we wanted a strength that was going to work, but not too strong, because we wanted it to benefit many, many people. And we came up with the right balance with mandelic acid, also and glucosamine. So we have that tightening effect, but this is an instant exfoliator. It has 3 really powerful molecules: resorcinol, salicylic acid, and lactic acid. And it can actually improve acne, it can tighten your pores, it will instantly take off the outer or dead skin layer of the stratum corneum. So you'll feel that kind of tightening effect, and some of our patients will even tell you that they feel right away, their skin gets tighter, their pores get smaller. Obviously you can feel that, but the true effects are going to be a month. You have to wait a month or even 2 months to really see tremendous benefit. Also, when you apply our products, you can certainly apply the cream, the serum around your eyes. Don't forget your neck. Even the women can use it on the décolleté or décolletage area. Don't forget that, even on their hands. So, and when you let that soak in, then apply your makeup for the ladies after. Don't put it on immediately, because you can maybe get a little pilling or balling up. But after it soaks in, you're fine. And so you first use the serum, first use the peel pads after you wash, just air dry for a few seconds, and then use the serum right afterwards, and you're done. We are coming out with a third product, which is our moisturizing creme, which has a new molecule called polyglutamic acid. One of my partners, Tom Rubeck, went to Japan. It's derived from the natto bean. It's a very unusual molecule that they're using there. We have use of this molecule in the United States, and when it's combined, the polyglutamic acid, when it's combined with the glucosamine and mandelic acid, we call it our tri-tightening complex. You get a mega moist effect. In fact, polyglutamic acid, or for you golfers out there, PGA, is something you'll remember. It is amazing. It's 4 times more hydrating than the gold standard today, which is hyaluronic acid. So that's a really great product to look forward to as well.